Essentially, there's going to be three theories of applying light therapy for a polyneuropathy. All right. Number one is treating only the symptomatic area. So if that's somebody with diabetic neuropathy in the feet, you treat just the feet, right? Treating just that symptomatic region. Second theory would be to treat the nerve origin where it starts, right? So in our, foot neuropathy case, you'd treat up at the spine and then follow that up with treatment in the symptomatic area down in the feet. The third theory would be to treat the entire length of the nerve, like the researchers in the paper we just saw mentioned, starting up at the spine, working the entire length of the nerve all the way down through the endings of the nerves. Three main approaches, right? Okay. That's about all I can get you from the research. All right. I would love to have more research to show you, but that is the most specific we can get at this point for what seems to work. If you can do this in practice, you can do it well, then most of the physicians and healthcare providers that are doing this will report income growth from anywhere from 10 to 80% within about 3 months, depending on, many factors, of course, practice model, your capacity, how long it takes you to deliver these treatments, and, how well you're doing, with how well your patients are doing being the biggest factor here. Now, statistically, most of your existing patients, if you're either a physical therapist or a chiropractor or even a primary care provider, many of your existing patients have neuropathy. You may not even know about it. They may not have told you about it. You need to let them know that you have a possible solution for them. That's where things like in-office marketing materials, things like what we provide here at the LTI, little brochures that you can have and posters, things like that can help spread the word in your practice for your existing patients. But before you get into that, you need to make sure you have the system in place to enable this success and support that growth. You got to have a good laser therapy unit. You've got to have good protocols. You got to have a treatment evaluation of that patient and be able to track their success through re-exams. You need to have that in place first before you just start going after it. The biggest thing here is if you're getting good results, that is self-sustaining. That growth will continue to go because these patients are going to be thrilled that you can do something for their neuropathy, and they're going to tell other people. Ultimately, you'll only get growth in that 10 to 80% if you're having patient success. So what I would encourage you to do, and what I've tried to always do, is focus on getting the patient better. Let the money take care of itself, because it will if you're successful. Again, to go back to this, these are kind of the barriers. This is why everybody is not doing this. But you have to have a good, effective, and reliable photobiomodulation device, because if you don't have one that's reliable and it goes down, it'll cost you a lot in terms of missed treatments, missed appointments. You also need to have effective protocols and settings, because if you don't, you won't be successful. Your intake and your reevaluation process must be excellent. They have to be nailed down. You need to know what you're doing before you bring somebody in and try and treat them without knowing what's going on or knowing if they're improving. And then you do need to have at least some level of supportive nutrition and supplementation in place. Again, just simple as B vitamins. Are their B vitamin levels correct? Okay. And this is the point at which I say, hey, this is where our services really come in, because we can offer you guidance on some of these things. You may not need it. Some of you are here going, no, I'm pretty good. I'm just picking up some new things. That's great. But if you're one of those, and I would say most practitioners, you don't quite understand enough about laser therapy yet. You're still learning. You're not sure what kind of device you need to be using. You're definitely not sure what you need to be doing on your protocols, on your settings, maybe even on your exams. If you want guidance on that, what we've put together is a really good neuropathy specific course. Most of it is online courses. You start with laser basics to understand some of these parameters we talked about, like wavelength, energy density, power. And then you go through laser courses 101 all the way through 310. That's all online, and it will help you and your staff understand laser therapy, understand how to apply treatments. And this also includes 7 different proprietary laser settings that are designed to help your neuropathy patients with their symptoms, right? That's all included in our foundations and neuropathy add-on course. You can also just go ahead and jump into everything. If you want to look at an LTI membership, you get all that. Plus you can get the rest of our, custom settings that we've got put together, the protocols that we use. These are all based on research and then have been used in practice where we see what the success rate really is. We made the adjustments. We've kind of already done all the legwork for you. So we can just hand this over and say, here, go forth, use this so that you can be successful, not have to worry about things like developing the protocols, figuring out which settings work and which ones don't. A really good place to start, and we're going to give you this link, is this page right here. This is on our website, and it actually takes you through, Jay's going to talk about it a little bit, but it's going to take you through a lot of different steps, most of which are completely free. You can go through these different steps and make sure you're set up for success.